So we are glad you are here. This month we are talking about On the Other Side of the Stethoscope. This is a focus by our Life Sciences Department and a real focus on nursing, but also other healthcare professions. Then another thing that I want to bring your attention to, I really want to encourage you, we have an opportunity. Texas Women's University has invited all TCC students to come for a day to see the research labs, to learn about what's going on at TWU, to see what it would look like to be on a university campus doing research. And so they still have, last I heard, they had about 18 slots left. So if that interests you, you don't have to go to Texas Women's University, which, by the way, is not only for women, but if you are interested, as long as you can get yourself to the Texas Women's University campus, they have phenomenal healthcare programs. You would get to see some of what they're doing, see if that's a place you would be interested in. And then out of the people that go to that, they will take, I think, 4 people to do a summer internship, research internship. So really cool opportunity. It's up here. I know that's really small. If you're interested in that, we have flyers down here afterwards that you can grab. And then I want to tell you this. We have a phenomenal library here at TCC. They're just around the corner by the stairs with books, and they have LibGuides, and I just want to show you what this looks like. For every STEM So What presentation, we have a LibGuide. So here it is, and you can always find it. You can pull that up anytime you want by Googling TCCD LibGuide. And if you look across the top, I don't know how much you can see. Those of you who are sitting down here, I think you can see it well. Good choice. But there's every STEM So What that we've had. There's a video from that, and there's information. And for you guys who are here to learn about On the Other Side of the Stethoscope, if we scroll down a little bit, you'll see there are some videos about nursing, some really helpful videos, a day in the life of a registered nurse, and keep going. And there's links to books, not just physical books, but also e-books that are available from our library. And if you keep going, there's some information about career resources. Dr. Coleman, who I know a lot of you are in her class, and Dr. Dr. Jadka, mentioned this, that the American Nurses Association and the Texas Nurses Association, even before you become a nurse, it's a good thing to check out their websites. They have a lot of scholarships. So if you're interested in a scholarship, that would be a really smart place to go. So those LibGuides have a ton of information. You want to make sure that you check that out. And while we're doing that, I want to make a plug. The library, I lost the paper, but the library table, they have information about their maker kits. If you're interested in trying to make a YouTube video, you can get a camera, a light, all the supplies to do that. They have stuff to make, I think, sewing and knitting, and be sure and check that out. It's really neat. Our library not only has books, but they also have the maker kits. They also have games if you need a break, stress relief. So be sure and check that out. And then we'll go back to the other announcements. One other thing, and oh my goodness, that's going to be small. If you haven't done it yet, you might want to look on the TCC website. I figure a lot of you are interested in nursing. That's kind of our target audience for this, or any sort of science. But if you are, you need to know that at TCC, there are lots of degree options outside of nursing. We have a lot of healthcare opportunities. And so these are screenshots that I took from our TCC website. You just go to the main page and scroll down and click on Browse by Pathway, and then you can get to the healthcare pathway. But you can see there's lots of nursing, vocational nursing, a patient care technician, and then nursing. But then there's so many other things. Surgical technology, CT, to do CT scans. Amazing, like the opportunities and all varying degrees, whether it takes 2 years or it's something that you would transfer to a 4-year degree. So be sure, look at your options, make sure you know everything that is out there. And speaking of which, at the end of tonight, if you would like more guidance on your healthcare pathway here at TCC, the Biology Club has some papers. It's this healthcare major exploration. And if you get that paper, you can then go to a QR code where they have advisors that will talk to you about everything you need to know to make sure you're doing the right thing to complete that degree. And especially some of those targeted degrees, you have to go to a meeting before you can actually enter that school and that program. So you just want to make sure that you're aware of all that. And so those are the announcements that I have for you. And with that, I want to quit talking and I want to welcome who you're really here to see, Sonya Williams and Dr. Coleman.
Thank you so much for coming out tonight. We're so glad that you were able to take the time to be here. And it is an absolute pleasure to be able to introduce the speaker this evening, Sonya Williams. Sonya Williams graduated with an associate's degree in nursing in 1986 from Tarrant County College, which was Tarrant County Junior College at that time. In 1989, she completed her Bachelor's of Science in Nursing at the University of Texas at Arlington. She currently works at Children's Health, formerly known as Children's Medical Center in Dallas. She is thrilled to be able to currently work part-time as an inpatient staff nurse in the clinical resource pool. She works 2 12-hour shifts per week. She has an adult daughter, Mallory, and she says her granddaughter, whose name is Journey, is her broke best friend. She loves to read, bake, travel, have a good time, and eat delicious food. Who doesn't? Sonya Williams.
Hi, everybody. Thank you so much for giving me this opportunity to talk to y'all tonight. Elaine kind of left a lot of this up to me. I'll go ahead and give you a disclaimer. If you ask me a question, I will tell you the answer. I don't sugarcoat anything. I've heard people say behind my back, Sonya's very blunt. Years ago, I had a friend say, you know how when people think things but don't say it, Sonya says it. So I just put it out there. So if you have any questions, be prepared to get the real answer. As Elaine told you, I graduated, next year will be 40 years ago from TCJC, as it was called at the time. And I was just telling Elaine and you that at the time I went to TCJC, we had the highest NCLEX passing rates in the whole Dallas-Fort Worth area. So I'm pretty proud of that. I mean, I feel like I got a really good education. It has served me well, and I've been very blessed with a career that's been good, bad, ugly, sad, and very exciting. One thing about me is I'm not that person that goes to a job and just stays there forever. I always tell people that my resume is as long as the state of Texas. When I get tired of something and want something new, I just go on to something new, and I'm blessed to say that I've never left a place that I couldn't come back to. I just get tired of things and just want to change it up, so I go somewhere else. I started out when I first graduated, I was at JPS. I don't know if y'all are familiar with that. It's the Tarrant County Hospital. It's part of Tarrant County Hospital District. It's in Fort Worth. And for all the people who are in Tarrant County, that is our hospital. If you are indigent or if you're You don't necessarily have to be indigent. If you get shot, trauma, you want to go to JPS. Just like if you have a really severe burn, you want to go to Parkland. Parkland is the hospital for Dallas County. That's their county hospital. I worked there in postpartum and newborn nursery. This was when they didn't, and we took care of the moms and the babies. And this was before you had to keep your baby in your room like they do you now. We had these little carts with 6 little compartments. We'd put 6 babies in there. We'd wheel them down the hall, and we'd just go room to room every 3 hours. Get the moms, feed your baby. Some of the mothers wouldn't wake up, so you have to go back in there, wake up, feed your baby. And I did that for a while, and then I went to Cook Children's, and I actually worked hematology, oncology, and we also had general pediatric patients. Back then, hospital units were not as specialized as they are now. So if somebody had surgery, let's say they had an osteosarcoma, which is a bone tumor, and they had to have an amputation, they came back to us straight post-op. I mean, they didn't go to a surgical unit and then come to us. So we took care of everybody back then. It was a lot different. Hospitals have changed a lot. Nursing has changed a lot, but the primary focus of it to me has always been to take good care of my patients and families. Because one thing about nursing, that patient might be laying in the bed, but I got to deal with everybody in here. I work pediatrics, so sometimes that is a lot of people. Everybody knows, think about your own family. Most people have 2 sets of grandparents. You have aunts, uncles, you have cousins, you have so many people. And a lot of times it can be very difficult to deal with all these people because they'll all have their own opinion. Yeah, all of them.
Was it the patient care experience part that got you into nursing? Like, did you just have a heart for patients that you wanted to take care of them when they're sick?
Well, I like the relationships that you get to build with people, and like to learn. I mean, just in my career, so much has changed. When I first graduated, there were certain, I'll just use this as an example. There were certain diseases that people got that basically there was nothing that they could do except supportive care, like just make you be comfortable. Now, some of those diseases, there's cures for them. People are having the disease and then they're going on to have good lives. So I like taking care of the patients and the families. I like the camaraderie of the coworkers, because nursing, I can only speak for nurses. I'm sure physicians, respiratory therapists, radiologists, we have really, really dark sense of humor. There are things that are funny to us that other people are like, what? They can't believe it. What, you're laughing? And she only had half of an eyebrow? Yes, that's funny to me. I mean, we have to find things that we can laugh about, or sometimes we'd be crying all the time. Yeah. So we have a real interesting sense of humor. I guess I shouldn't say dark, but interesting, very interesting.
Have you always been in a hospital setting?
No, I actually worked in a pediatric hematology oncology clinic, and I was a chronic transfusion nurse. Most of the patients had sickle cell anemia. They're chronically transfused, and by that I mean they sometimes come in every 4 weeks or every 6 weeks or every 3 weeks, and they get transfused. And it's basically because, if you think of it in this way, if you have a cup that's full, and say it's full of sickle cells, you're going to put more blood in there to push those sickle cells down to try to get rid of them, get them out of the body, and then fill it with good blood. I also worked 2 years with adults in an oncology clinic. And adults, y'all, we are hilarious. I mean, you'll tell somebody what they need to do, and they'll just look you right in the eye and say, I'm not doing that. I wasn't used to that, because kids, if you don't do it, we're going to make you do it. Do I need to go get my friends to help me give you this medicine? Adults will just say, no. Adults are funny. But the sad thing about adults is a lot of the things that happen to us is because we don't do what we need to do. Not everything, but a lot of things. But I did like that job. That was at UT Southwestern, and I actually worked with the oncologist I worked with was actually younger than my child, and he was a trip. I know he had a genius IQ, but the common sense factor was kind of low. So he was really, really funny, especially because I got to work with them when they had their first baby. And he came in one day and actually said, this baby's not doing anything like what it says on the internet. I'm like, what? And he was serious. Yeah.
Do you feel that the attitude from adults and just the number of people that are saying, no, I'm not going to take that medicine, or no, and is it about medicine? Is it about the procedure that you've got to change out their IV? Do you feel like the amount of that has increased? Has it become more difficult in that sense?
Well, since you asked that question, I feel like people are different now, for want of a better word. The way we talk to each other is not the same. The way we treat each other is not the same. But for the most part, I feel like when people are sick, that's still the same. They want to get better. A lot of people are just scared. A lot of people feel out of control. So the way they can control what's going on is just by saying no to different things. They might not even need to say no, but they'll say it because that's something that they can control, whether or not they take the medicine or whether or not they... So I was working with a liver cancer specialist, and so naturally he wanted the people to stop drinking. Well, most of them would just come in there and just tell you the truth. He'd ask them every time, are you still drinking? I remember this one man, 6 drinks per night. I was like, how are you even holding your head up? I was thinking. But he admitted it, and then I had another patient come in one time, and he said he had stopped drinking, and he had his 2 adult daughters with him, and they said, Dad, really? Oops. So people will tell on you too. So I just feel like a lot of it is just control, and then adults, we're really stubborn and hard-headed. I mean, we want to do what we want to do, regardless of if it's good or bad. So I feel like that was a lot of it too. A lot of people just don't want to be told what to do.
Do you feel that there's an aspect to your job to try to educate patients? Why is it important to lay off the drinks if you've got liver cancer? Why do you need this medicine? Why do we have to do this? What kind of... Did that come with time? Was it easy to do?
Well, education is just always something that is ongoing with everyone. I didn't feel like in that clinic setting, to me it's the doctor's responsibility to tell them why they need to quit drinking and how drinking is affecting whatever they're doing, or why they need to quit smoking, or whatever they're doing that's causing them harm. But then as an adult myself, I can see why people would not want to stop, because they're like, I've been doing this long and I've already got cancer, so oh well. And people really do feel that way. They don't feel like they're going to get cured if they stop, so why not, I hate to say it like this, but let the good times roll. I mean, they don't want to change their habits. It's kind of like me when I go to the doctor and the doctor says that crazy thing like, well, let's look at your weight. And I'm like, let's not. Yeah, let's not. It's the same thing, They may tell you what you should do, but you don't always do it. That's just reality.
There was a time in your life when you were the patient, and this was very different to go from you're the caregiver and now you're the one that needs care. How has that shaped you as a nurse?
Well, I think I can think of two things that really changed in me. One of them was I had to have a procedure. I don't know if anybody knows what a nasogastric tube is. It's a tube that goes down one of your nostrils, down your throat, and into your stomach. And I had to have that done one day, and I would not let them do it. I kept grabbing the person's hand, and they ended up having to take me down to the GI lab. I had to get sedation so she could put it down. And then the person who put the tube down told me later, while I was still in the hospital, she said, do you know the minute you woke up, you sat up and just pulled the tube out, so we had to put you down again. So the first time that I put an NG tube down on a patient after I'd had one on me, when I walked out of the room, I cried because I know what that feels like. And it is not a good feeling, not at all. And the other thing I think is when you push the nurse call light and you ask for something, 15 minutes seems like 15 years if it's something that you really need. So when people yell at the nurse and say, I called you 30 minutes ago, and all you can think in the back of your mind is, but you're not my only patient, or, you know, we just coded this person, or they just fell. You can't say that to them, but you can get their point that when all you have to do is lay in a bed and look at a clock, time really, really does go by really, really slow, real slow, yeah. I guess that's it. I mean, I have a lot of other examples, but y'all don't want to hear all of them.
Well, you've talked some about your interactions with patients. When you first started out, you might have had an envision of what the job would be like, and then there's this patient contact that they may not train you for as much as they train you for in the book information. Were there things about that surprised you? Were there things that you had to learn? And what would be your recommendation for someone starting at that point, and they're going to have to interact with people from all walks of life?
Well, one of the things that's so important to me is you have to remember that everybody is not like you. Everybody in here was raised differently, has seen different things, has experienced different things. So there will be a lot of situations, for want of a better word, that you might think are so shocking, but to that family, that's how they live. It's not shocking to them because that's their everyday. So if you're not an outgoing person and you want to be a nurse, especially at the bedside, try to at least get to know other people who aren't just like you, because that will always help. I mean, I really feel that. I mean, my dad always said I never met a stranger, and I don't. I mean, you could take me to a party, I don't know anybody in there. I'm still gonna have a good time because it's a party. Yeah, I'm gonna have a good time unless the people are just, I don't want to say total losers, but just total, I don't know, weirdos maybe. I mean, I can pretty much talk to anybody, you know. I mean, we can find something that we can talk about. So just try to, it's scary at first. I remember how scared I would be every time I walked into a room. You know, scared they were going to ask me a question. What if I don't know the answer? Scared they were going to be angry. Just scared. But course, I've been doing this a long time. Now I just try to take people for where they are. If they're angry, I'm like, I know it's not me because you don't even know me. So just try to figure out what's going on and diffuse the situation, I guess is what I would say, yeah.
Okay. What about the younger patients? Children are a different ballgame. There are things that they don't understand. They don't understand why they have to be there. They don't understand what's happening to them. Everything's scary or everything hurts. In your time dealing with the younger patients, was it hard at first? Was it a labor of love? And then are there things that you have learned to be able to do to help those younger patients feel more comfortable in this strange environment?
Well, it really just depends on the age. I mean, you have to, if they're old enough to understand, try to explain everything to them. And even adults, never just come at somebody. Tell them what you're going to do. Or, I'm just coming in here to look at your IV pump. I'm not even touching you. You're fine, because especially when they're really little and everybody stuck them with needles and they have an IV and then they've had to do this and that. I mean, they see anybody walking with scrubs, they just go to their other place. I mean, and I'm talking about other place, like lose their minds. So you have to just try to be as gentle as possible, give them their space. I've sometimes just asked the mom or the dad, will you hold them so I can take vital signs? At least they know somebody's arms are around them that loves them, instead of them just laying in the bed. I had a little boy the other night, and he was laying in the bed with the daddy, and I came in there in the middle of the night to do something, and I mean, he shrugged his shoulder at me like, get back, lady. And he was only 2. But when he looked up and saw it wasn't bothering the dad, he just went back to sleep like, okay, I'm okay if daddy says she's okay, I'm okay, yeah. So they're just all over the place. And of course we have different syndromes. We have children with different syndromes. We have children who have developmental delays. We have just a lot of things. I always just try to defer to the parent. You know, what's the best way for me to do this or that? And they usually tell you.
What are the things that keep you going? Do you have patients that you think of that are special moments and you're cheering them on because you want to see them get better? Is it something about the job that just keeps you moving forward? Certainly, especially coming out of COVID, there's just been such an increase in the number of nurses that are feeling fatigued.
Yeah.
They're tired. They're frustrated with some things. They're discontent. So for you to continue to seek this out, what is it about nursing that just continues to motivate you and inspire you forward?
A lot of times sometimes it's memories. I mean, we didn't have HIPAA, if anybody knows about that back in the day, but I have had 2 favorite patients that I've had in my life. One of them, his name was Robert Newville, and he was 5 years old. And the other one was Orlando Jordan, and that was my boy. He was 14. He was always alone. And I can remember one night I was in charge, and I was in his room, and they had recliners in there, and it was during the Final Four. And I sat in there and watched a whole basketball game with him at work. Don't tell they're probably not even there anymore. But anyway, I sat in there and watched the whole basketball game with him. And I remember him looking at me at one point and going, wow, Sonya, you really are in charge. Like, I mean, I had the recliner back, everything everybody knew where I was. You know, and I said, if y'all need something, come get me, because I'm being here with him. But just old memories and just trying to take care of me. If you choose to do anything medical as a career, make sure that you always put yourself first. You have got to take care of you. There is burnout, it's real. I've experienced it. You have to remember that you can't fix these families. That's really hard for me. So I'm like, they don't even need to take this baby home. I need to take this baby. I don't like how y'all are acting. Do I say that to them? No. But am I thinking it? Yeah. But I don't have the resources to take everybody home with me, nor would they probably want to go. I mean, because they don't even know me. But just take care of you and know yourself well enough to know when you have had enough, when you need a break. I always tell people, take your vacations. I don't even care if you're broke. Take it and just sit at home. If you like to swim, find somebody with a pool. Say, girl, I'm going to be over there hanging out every day. You don't have to do nothing for me. I got my picnic basket, brought my toilet paper if I need to go to the bathroom. I mean, I'm just chilling. But if you can, always just try to get out of their environment and try your very best, and it's hard to leave work at work. Because this is a very, very emotional profession. You don't just take care of somebody and forget them. Unless I don't know who could, but just take care of you. I think that's the most important thing I would say. Take care of yourself.
There is a phrase, evidence-based medicine. Can you explain exactly what evidence-based medicine is referring to, and what do you feel are some of the advantages and disadvantages of evidence-based medicine?
Well, I actually looked up evidence-based medicine because I was like, what does that even really mean? And so I looked it up, and it's basically that the medicine allows the person to either to live longer, or basically, and this is Sonya style, or to live better. Everybody in here knows people that have lived long lives, but they were not good. That back end can be pretty raggedy. Sometimes, to me, there's more to life than just being able to take a breath. Living is having a good quality of life. And I know that's such a pat saying. Living is still having enjoyment to me, whatever it may be. Evidence-based practice does that. Like, it looks at the quality of life that people have had. It looks at the efficacy or how well the drug has actually worked. There's some medicines that they may work, but the side effects are so bad. So what if I get better? I feel horrible. So that's not really a nice way to be. So evidence-based medicine just helps look at medicines, the side effects. I can think of a lot of different things. I don't know why Dilantin popped in my head. Dilantin was one of the main medicines for seizures when I first graduated. Now it is very rarely used because it could reach a certain level. You always had to check the levels, and you could become very toxic on Dilantin, with just different things like you could change your mentation. It could do a lot of things, and it didn't always keep you from having the seizures. Now they have so many new medicines that they've even found out a lot of medicines are good for more than one thing. I'm sure everybody sitting here has heard of, not Cialis, but what's the other one? They have the commercials. It's so corny. Viagra. It's actually a blood pressure medicine. Yeah. First time I got ready to give that to some little girl, I thought, what? Why am I giving her this? Of course, we always need to know our meds. Looked it up. It's also to control blood pressure. So there's a lot of different meds that do a lot of different things. And I'm so glad you're in the front. Every time I look at you, I just want to hug you. You always have a very sweet face. And you too.
Over your time in nursing, you said that you've seen a lot of things change. Can you talk a little bit more about what it was, what it is now, maybe some changes that you think are good changes, sometimes that are coming from research and evidence?
I guess I would just a lot of new medications, a lot of new treatments, better survival rates for a lot of different diseases. That's, of course, very exciting. I always worked oncology mostly, and I remember when I was a little girl, he happened to be my brother's age, got leukemia, and there was nothing they could do. All they could do was support him with blood products. They literally had no treatment. Now, there are adults walking around who had leukemia as children. You know, they were completely cured. So things like that, that's a real positive. On the negative side is I just don't really care for how people treat each other now. Nurses used to not be talked to crazy, like they were standing on a street corner or working at a bar. That is a big change to me, and it's scary. I don't want to turn this to a downer, but I don't know how many of y'all saw that the nurse who was literally beat up by a patient and he broke every bone in her face. Yeah, it happened this week. I've got a friend that's an RN, and she's always sending me this kind of stuff. I don't watch the news, and I probably stopped 20 or 30 years ago because it makes me cry. I mean, it just has so much sad stuff, but a patient apparently who had mental health issues was admitted into a hospital for his medical issues. And a nurse who was caring for him, he just beat her up, almost killed her. And I know everybody maybe not have heard of, there was a shooting in Dallas, either last year or a year before, in a labor and delivery area, where a man who had recently gotten out of prison had come into the hospital. It's going to be a whole big mess. But anyway, he, I guess, wanted to see his new baby. The girlfriend was in there having the baby. Please don't ask me why he felt like he needed to kill people. But this is just, I don't want to say the world we live in, but it's because that's really sad. But just in the time I've been at Children's Health these past 2 years, we have a metal detector that we have to walk through every night. And I am glad of it because Texas is open carry, and it's not illegal for somebody to come in, walk around with a gun. But at least they get stopped at the front. And unless they're law enforcement, they can't be in there with a gun on them. I don't particularly care for that our security guards aren't armed. I'm not over anybody, so there's nothing I can do about it. But it's very scary. And people get real out of control when it comes to children. Sometimes parents are divorced. The mother will come in and say, I don't want his daddy up here. Well, ma'am, do you have a court order? No. But if he brings that girlfriend of his, then I don't know what I'm going to do. Well, what can I do? I mean, if you don't have a legal document saying that person can't come, if they're their parent, they have a right to come up here. So different things like that, to me, seems like it's more and more of those type of instances. And don't even get me started on the gentle parenting, because these kids that don't obey, if they don't obey when they're well, heaven help us when they're sick. It's not pretty.
So do you have advice for new nurses, for people that are heading in there, to know how to navigate these situations where maybe sometimes they have to call security, or to navigate grumpy patients?
Well, I guess just try to remember the situation. You know, we sometimes see people, well, pretty much at their worst. You know, so many of these diagnoses are very devastating, and people think they're just taken, I don't even want to say by surprise, it's just they're just in shock. And a lot of people don't get a lot of rest. And I know me, if I don't get my sleep, no bueno. I mean, it is just not good. So you think about, you've already got this very sad situation, then you're not getting any rest, then you're, somebody's always in the room. You know, how many of us are used to going to bed at night and having somebody come in there at least once an hour? I'm not. Yeah. They can't a lot of times really sleep. I've had patients sometimes when it's a baby, every time that baby sees me, she might open one eye. She sees me, she loses it. Well, then the mom or dad's got to get up and comfort them. So they're just a lot of times real tired. And I actually put that in my notes today. I just put, if somebody is a jerk, excuse me, they're just going to be a jerk. So it probably doesn't even have anything to do with you or the hospital. That's just the way they are. So they're not going to be any nicer in there than they would be in Kroger if your basket hit theirs. I mean, they're just not, some people are just not nice people, and they don't care how they talk to anybody, which is real hard, but that's just the way it is. I guess that's really it. Just prioritize yourself. And most of all, if you ever feel like a situation is going way south to the point of danger, make sure that you get out of the room, get out of the way, or if you feel like something is escalating, let people know. Yeah. Don't, oh, well, it's probably me because I'm doing this, and they're probably just mad at me. It's better to let someone know and be watching out for you than to end up getting hurt. Because sometimes people, and a lot of times, they give us signs that they're not how they should be, that they're very angry, or they'll say things that, you know, if this doesn't happen, then I'm doing this. Well, when they start threatening, somebody needs to know. Yeah. And, you know, you can always call. You can always call security, and I'd rather them be standing there and not need them than need them and they're not there. Mm-hmm.
Have you trained nurses in the sense that they, like they're new and so they're with you and they're on the job, and do you observe some common mistakes? Are there advice that you can share based on those experiences of what someone should do once they're starting their clinical rotations or once they finish and they're taking their first job?
I always try to have a plan and teach them to have a plan. If you are really nervous, sometimes it's hard to consolidate everything. Like, by that I mean anticipate things that are going to happen. Let's say I'm taking a med in the room and it's by mouth. I need to bring something to drink, because if I get in there, they don't have anything to drink, then here I am back again. That's just wasting time. Try your very best to work as a team and help each other. You know, if you look around and you're sitting at the desk on your phone and nobody else is there, that probably means other people need help. So get up and go find out how you can help other people. Mostly it's just overcoming your nervousness about It's hard to walk into a stranger's room. And, how many of us would just jump up and drive down a neighborhood street and just go to somebody's house and say, "Hi, I'm so-and-so." That's what it feels like. You don't know these people. They don't know you. And I'm telling you, most of them are going to be, and I don't mean checking you out like a bar scene. I mean like, does she know what she's doing? Because what else do they have to do? But sit there and watch everything. 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 So just try to exude confidence. Even if you don't really feel that confident, at least exude it. Don't be scary, because that's how you mess up. Yeah. And if you have to sit down and make you a plan, first I'm going to do this, then I'm going to do that, shoot, do it. Yeah, I do that. If I'm real busy and there's a bunch of stuff to do, you have got to learn to prioritize. So why not start at the beginning?
Are there things that you've seen people come in and do and just right away they impress you because they did something in particular, or they were ready to go, or what did you see that was impressive?
I think one of the things that I see is when you can tell somebody is a really good person and that they were raised right. It really shows. Because a lot of nursing is just how we treat people. There's most of everything that you do as far as a skill. In 2025, people are doing it at home. You can teach their mom how to take care of their central line, or their mom how to give an injection, or their mom how to X, Y, and Z. But to take care of so many different people, I wish I'd kept a list. I'm sure I'd be in awe of how many different people I've cared for. But at the same time, it's the caring and the organization and the knowledge. And whatever you do, I know this sounds so obvious, but don't ever lie. If you don't know the answer to something, say, "I don't know, but I'll find out and I'll get back to you." And don't say, "I'll find out and get back to you," if you're not going to find out and get back to them. Because people really, really trust us. Probably shouldn't say it, but to me, this is the most important job in the world. There is nobody here, unless they were born at home, that hasn't encountered a nurse, even if it was at birth. No one here. And as time goes on, you may encounter more. There's some people that live their whole lives and never get sick, but not many. Yeah. Yes. Oh.
Okay. What about for some of us who actually have family members who are nurses? Because I actually have an aunt in Washington. She's a nurse.
Mm-hmm. Well, I hope she sets a good example. I try to for my family. The thing that's so funny to me about once you say you're a nurse, people don't know what you do. But I don't know how many times I've it usually happens at church for some reason. Somebody will come up and go, "You're a nurse, right?" And I'm just like, because I have no idea what they're going to ask. The last time that happened, the person literally pulled her blouse to the side and had this thing attached to her upper chest. I almost saw her breast, and this is at church. So I said, "Yeah." And she goes, "Well, can you change this for me?" And I said, "What is it?" I had no idea. And so she gave me the little box. It was actually a Well, y'all are so young, but there used to be a thing called a Holter monitor. And when people had like irregular heartbeat or different things, they would wear the Holter monitor. Well, this little thing was a Holter monitor. So I'm sad to say, and I had to ask God to forgive me, I read about those instructions during worship service. I tried to sing, but she had put me on the spot, and she said, she told me basically, I need you to change this after church. So I was like, I had to be ready. But I know God was like, you know what, I got you. Because he realized I was doing something right. I hope he did. But yeah, and I changed it. So people are always going to be asking you whatever, to look at this bump on their booty or something. It's like, you know what, no. Sometimes you really have to say no, but people will ask you everything. But like I say, just tell them I don't know, but I can find out. And I don't want to look at your booty. Yes?
Oh, first off, I wanted to say thank you so much for your attendance. I have a two-parter. The first question is, when it comes to different generations, so from Gen X to Millennials to Generation Z to now Generation A, how does the variation between different language barriers to different ideas, different standards, how does that affect your job? And then implementing kind of a code switch, in a sense, to basically pivot. Additionally, with dealing, to my second question, with dealing with those individuals, how do you, my mother always used to say CYA, but how do you make sure to document each and every encounterment and make sure that you are precise? Because I know that's a big part in nursing.
Both of those are really good questions. As far as handling the different generations, that can be really, really tricky because now this is my opinion, the way I was at 18, to me, is not the way an 18-year-old is now. When I graduated from high school, there were people that were going into the workforce and getting their own places and working, and some of them are probably still working at those jobs today. So you do need to be more cognizant of the differences, and that's just, to me, more of never stop learning. I love to read, and I don't want to say I'm a people watcher like I'm a creeper, but you can tell the differences in the way people are if you spend a lot of time around people. Languages, that's really, really difficult. We carry phones, and that's what we use to scan our meds, and of course we use it as a phone too. You can look up stuff on it. We use it for our labs if we draw blood and we scan the labs. Now they have put an interpreter on there, but it's for Spanish only, and that is great because we have a lot of Spanish-speaking patients. I mean, there are a lot of patients who and neither parent speaks English. And of course, as everybody in here knows, there's a whole lot of other languages. And so we have, it's basically just an iPad, and you can pick any language, but every once in a while, even with that, there will be people that speak a certain dialect, and it's not on there. So sometimes they'll have to try to find interpreters through these different services. That can be really, really tricky because I actually had a patient one night, I think it was the mother's friend, was using like Google Translate, and she was trying to tell me something, and she held it up to me, and it was something like, "Can the baby have a beer?" B-E-E-R. And I was like, and I thought, I'm sure that's not what she meant. She meant bottle. But however she was saying it, I had to go. Of course, me being as goofy as I am, I walked out of the room and just, I know that's not what she means. And so I got the OD, which is the translator, the iPad, and brought it in there. And she was basically saying, "Can the baby have a bottle?" But when she held that up to me, and it was two couples in there, the mom and the dad of the baby, and then this other couple, and they just all looked at me like, "Why is she looking so crazy?" You know, I'm sure, I mean, that's what their eyes said. And I just thought, but then I didn't want to say cerveza because I know that means beer in Spanish, but I didn't want them to think, is she wanting the baby to have a beer? I mean, I just was like, just get the translator. So that can be very, very tricky. And it's really, really nice when you have a nice friend working that speaks Spanish. Because to me, it works so much better if I'm just talking to you versus I'm talking to the interpreter and the interpreter's talking to you. I know it's the same, but it's really not. Yeah.
Hi. So I don't know much about this, but I read a while back that, y'all have to do like charting, for your patients and stuff. I heard that there was something called like batch charting, quote unquote. But I read about like hospitals like rushing nurses to like do it later on and like estimate the time that they gave patients like this or that. And then, a lot of people got in a lot of trouble, or they lost their license because they claimed that it was at a certain time that they gave a patient like a medication, but it was the wrong time or like it was the wrong medication. So I was gonna ask if you've ever seen that like in real life, but.
No, I haven't. They really encourage charting in real time, as they call it, but you do sometimes have to catch up. If I went into a patient's room and I don't want to say got stuck in there because that sounds so negative, but wasn't able to get out for like an hour, then every hour you have to chart their intake and output. So they're getting IV fluids and it's going at 50 an hour. Every hour you have to put 50. You might go into a baby's room and there might be 3 diapers laying there. Well, I don't know when they had these diapers. If the parent didn't write it down, then you weigh the diaper, you just kind of have to guesstimate. And then same for eating, how much of this Gatorade have you had? Well, I don't know when they started drinking it, but for the most part, just be accurate. And I didn't even answer the rest of his question about charting everything. That is never changed. That's one of the things they just told us from the beginning, almost 40 years ago, is if it wasn't charted, it wasn't done. And the thing about pediatrics is, if I take care of a baby today, those parents have 18 years that they can decide to do a lawsuit. So chances are I'm not going to remember exactly what I did 18 years ago on that shift. But if I have it documented, I'm fine. Yeah, we have to document everything, especially education. Because if people leave and they don't know something, and I just say, well, I told her, but I didn't document it, who's going to win? Yeah, they will.
Hi. My question is since you have a lot of experience, what habits have you seen new nurses that have come in that you wish weren't habits that they had, or something that you've seen that something we can start working on. That way we don't go into the workforce, for those of us going into nursing, with any of those habits that are just something that may not be what I would realize is a bad habit for a hospital setting or clinical setting, or anything that you may have seen in the past with employees, and then they're out of there within 90 days or something. Just something that I might do that I don't know.
Okay. That is so easy for me, and it is stay off of the phones. So disrespectful. If my child or my mom or my nephew or a family member is very sick, and I come to the desk and I have pushed the call light and asked for something, and everybody is out there, or 2 or 3 people are out there just looking at their phones or looking at them together. Me and Elaine are both watching a video, dying laughing, and my child needs something for pain. I know it may not be your patient, but it is very, very tacky, because people don't know the day in the life like what we do. They see people sitting down, and I know y'all feel the same way if you've ever gone to, and I'm sorry if anybody works for Walmart, but gone into Walmart and said, where are the night light bulbs? And the person, I'm on break. Well, why are you standing here? So, in other words, it just looks bad for everybody. And everybody knows, and here we're seeing it everywhere. I was walking into work the other night, and the security guard that is sitting there by the metal detector is looking at his phone. I'm like, if that goes off and the person immediately pulls out a gun, you're not even looking. I mean, we really need to do better. And I mean, I include myself, even as old as I am, they become addictive. Yeah, they really do. And unfortunately, this generation and a couple above y'all are just hooked on their phones. Hooked on their phones. And it's like, unless you're a neurosurgeon and on call, which you're probably not because you're at a hospital, that Instagram post or your, I don't know, boyfriend sending you a selfie or whatever people are looking at, I mean, I don't know. It can wait, yeah. And we do get breaks, and if you just can't stand it, please wait to your break. I mean, it's gotten so bad that they're mentioning it in every staff meeting. Stay off your phones. And we know who's complaining, the patients and families. Yeah, that one was easy for me. Sorry, I can preach a sermon on that, and I apologize. That's too much.
Other questions? Anyone from the stairs also with a question?
As a nurse, what do you think are the most needed attributes to be a nurse?
Ooh, that's a really good question. To me, number one is to be a team player. You may be having a great shift, but somebody else may be drowning. So just be cognizant of your surroundings. Also, and I think I said this before, I know I did, remember that everybody is not like you. That is very, very important. We have to meet people wherever they are. You know, I take care of everybody from, could be one of the Dallas Cowboys children to somebody that's homeless. Not that I'm saying we have levels, because we don't. Treat everybody the same. I cannot stand to get report and somebody tell me, well, this is so-and-so, or the dad's a doctor, or the whatever. I treat everybody the same. I don't believe in VIPs, because if anybody wants to be treated like a queen, you're looking at her. Yeah. and everybody deserves to be treated like a king or queen. Yeah, they may be working your last nerve, but they don't have to know, because we don't know what goes on outside of this hospital. We don't know what people are going through. Some people, and there's probably people in here, some people's lives are so hard that you wouldn't even imagine. I've heard some stories of some stuff, and I thought, I wish I didn't even know people live like that. Yeah. So just treat everybody with respect. And don't wait until they respect you, because they may not. But treat them like you would want to be treated. Yeah.
We've got one question on the stairs here.
Hello, my question is that you ever experience nurse burnout, or you feel like about to quit your hospital job, or close to just that you needed a break from your job that you requested off, or something along that?
Well, I literally have actually experienced true burnout. I ended up having to take some time off and get some professional help. I was at work one day and I was eating my lunch and I realized I couldn't even taste my food. So I went on for a little while, and that was actually in 2006. And there were a lot of things that went on with my family that year. And I just went into work one day and I resigned. And I'll never forget, my daughter came home, and she was in high school. She was a senior. And she walked in, and I told her, I said, Mallory, I quit my job today. And she goes, what? What are we gonna do? And I said, have you ever known me not to take care of you? And she said, no. And I said, and you know how I always save for emergencies? And she said, yeah. I said, this is an emergency. I ended up being off work for probably at least 2 months, maybe 3. So I was really in a bad way. Yeah, really messed up. But just know yourself and take care of yourself. And the bottom line is, I always tell people, I don't just know about mental health. I lived mental health. I lost a sister to mental health. And so one thing I know about mental health is, if you try to hide, it doesn't work. Try to have at least, well, really all we need is one person, somebody who really gets you and who you can talk to about anything. If you can get that one person, you've really won. Yeah. And just always be open, not to everybody, because everybody knows we have those people that are so messy, they just want to know the scoop for the scoop, not because they care. But try to take care of yourself and be open to the fact that if you have problems. And don't be afraid to take a leave of absence. If you working for a reputable company, maybe a hospital, may not be, they have things in place for mental health. They do. And the bottom line is, it is nobody's business but yours. Girl, what's going on? Just ignore them. If they are not caring, don't share. That's just me. But take care of yourself. And because it's a hard job, depending on where you decide to work. You're going to see some things that are very, very hard to see. You're going to cry. You're going to get angry. You're going to have patients that never leave your mind. You're going to laugh at things that other people would think are disgusting. Your emotions are going to be all over. But try to have at least one person in your corner that you can share with. And try to make good relationships with coworkers. Even, not saying everybody's besties and let's all go do stuff together, but try to have real relationships, not just be coworkers, because you never know when somebody might really need you. And you want to be there for them because you want them to be there for you. Does that answer the question? Okay.
We have time for just one more question.
As a nurse, you are foremost the one at every bedside. You're technically the first doctor that gets in there. So what phenomenons have you experienced in your 40 years that you definitely have no explanation about? Or no theory on how to solve it?
Wow. I don't even know how to answer that. I guess you just never know how you may change someone's life. And I know that sounds so corny, or how they may change yours. For a perfect example, one of the times I went back to Children's, I recognized this one RN that I was working with. I remember taking care of her. She had cancer. But I wouldn't say that to her because that's her personal story. It's not for me to say. She literally came up to me and said, I remember you. You took care of me. And how cool is that? A nurse I worked with one time, she said she was at a movie with her grandchildren and a daycare came in. And a little girl in that daycare group yelled across the whole theater, "That's my nurse!" because she had taken care of her. I mean, how cool is that? I mean, might not be LeBron James, but I'm still cool. Yeah, I mean, you just I just feel like it's things like that just really touch you. Or when patients really talk to you about their lives and talk to you about the stuff they did at school and leave the "I'm sick right now" behind. I used to have we had 4 patients in New Orleans, and this is when you could do this, they would all go into each other's rooms and play spades and dominoes all through the night. They're in their mind having that good time. They're not thinking about this IV and this whatever. They're just crazy teenage boys being teenage boys. And I was always that charge nurse. My patients would say, "Sonya, my friend's getting off work at Taco Bell at midnight. Can she come up here?" I'd be like, "Sure can." There'd be other nurses be like, "No, 9 o'clock, visiting hour's over." Not Sonya. I'm like, yeah, because you need your friends. Yeah, you need your friends. So I guess it's just the relationships. And I mean, I know I'm a different person because I chose what I've chose for a career. I mean, I know I am. It's changed my life in so many ways. And to me, enriched my life. It made me a better person. Yeah, I know it has. I hope that answered it.
That's a great way to wrap things up. We appreciate your time so much. Sonya Williams, give her a round of applause.
Thank you, everybody, for listening to me. I know my voice is a little bit twangy and probably slow, but that's just me. But if there's anybody in this audience right now, if there's ever anything I could do for you, even ask questions or answer questions, please, please let me know, because we need whoever's out there wanting to go into this, we already need you. So hurry up and get out of school.
I have one favor to ask you all before you leave. She said she would do anything to help. If you have anything, ask, do it. So I have something I need to ask of you. If you all would please scan this QR code. We have a short survey. We want to know what you thought about this and how it makes you feel about the school. We want to continue to do activities like this, but we have to have data for our administrators so that they know that this is needed. So if you enjoyed this, if you want to be a part of this going on, if you want this to be available, please, I see lots of phones out, so that makes me happy. This is a good time to have your phone out. So get your phone out, scan that QR code, and please, please, please fill that in. Be completely honest. We want to know what you think. There's the QR code. Make sure you scan that, fill that out for us, and have a wonderful night.